嘅背景啦，
我嘅背景，
屋企嘅狀態啊咁樣啦。
有2個仔啊，有1個老婆啊，
阿
媽健在啊，我諗住呢份嘢應該阿媽好有興趣，我 feel 到。
Okay.
我覺得佢應該 OK， 因為佢都開始搞啲保健嘢幫我哋，因為我哋太忙。咁啊，我哋其實依家係早排係飲咗啲紅茶菇嗰啲茶，依家係飲緊雪蓮花。係啦，佢覺得即係嗰啲太極嗰啲 friend 咧話俾佢知，呢隻堅過嗰隻喎，咁就得啦，換季啦可以咁樣。係啦，咁呢個我覺得應該可以俾佢睇啊。咁當然我嚼完先，嚼完先俾佢睇。
我哋應該點樣稱呼你好啊？
跟揼得啦，
跟揼
係啊，
即係高達。有啲即係唔係咁熟悉跟揼啊，嘉榮高達，我哋叫中文名咧就方便好啲。好，唔該晒，咁我哋咧。
顱脊治療咧，實質係醫邊度同醫啲乜嘢嘅咧？
我哋首先知道幾個重要嘅資訊先。第一就係顱骨，其實就係骷髏頭個顱，我哋所謂頭顱骨。脊就脊骨啦。顱脊嘅意思其實咧，我哋有樣嘢要留意咧，就係所謂呢啲腦筍。我哋成日細個講咧，腦筍未生埋咧，其實我哋知道而家嘅醫學知道咧，原來我哋嘅腦筍骨到我哋入土為安，其實都未生埋過嘅。原來呢啲腦筍骨、呢啲腦縫嘅活動咧，原來可以開合咁樣活動嘅。咁我哋面頭冚住嘅咧就係一啲叫筋膜。咁啲筋膜其實覆蓋咗全個身體，包括頭顱骨啦、腦裏邊嘅腦膜啦，包括我哋脊椎神經根嘅脊膜啦， 我哋臟腑肌肉，我哋全身其實98%嘅組織臟腑其實都係俾呢啲筋膜一覆過咁樣覆蓋住嘅。而呢啲筋膜咧，將會同呢啲腦筍骨嘅活動係有個叫 synchronize 協調同步嘅一個咁嘅 pattern 嘅活動嘅。咁其實我哋就係感應呢一啲筋膜嘅活動，去幫佢調適翻嗰個順暢度，從而幫佢改善翻身體健康。咁我哋有個經常講嘅答案咧，就係我哋唔係針對特別任何嘅一種病，我哋乜嘢病都醫唔到，但係我哋對任何關於健康身體嘅問題咧都有幫助。
咁喺你嘅經驗當中咧，做呢類即係顱脊治療，最快見到效果會係即係佢有咩感覺咧？或者做完之後會幫到啲乜嘢咧？
頭先我講，因為我哋唔係針對個別嘅身體嘅問題，咁我哋一般都係偏向講叫處理一啲叫慢性或者叫做亞健康嘅問題。咁我哋純粹睇嗰個治療嘅過程咧，就唔係睇嗰個治療嘅健康嘅目的。係睇佢治療時間嘅反應，咁因為我哋都有一啲針灸嘅理論原則咧擺咗落去。我哋做針灸其實就係透過支針喺我哋穴位上面做一啲嘅調針，產生一個叫得氣嘅反應，能夠得到氣咧，嗰個穴位嘅功能咧就可以改善㗎啦。
就暢通啦。
冇錯啦。咁我哋其實做緊個治療過程，頭先我哋講啦，都係感應緊個筋膜嘅活動。我哋集中睇住嘅咧，就係睇佢嗰個叫做一個叫釋放嘅反應。咁我哋有個學術嘅名稱咧，叫做excuse me 治癒本能嘅一個釋放反應。咁有兩種釋放反應比較臨床上面比較特別見效嘅咧，第一個叫脈浪圖，即係話我哋掂住佢嘅一啲身體嘅部分，佢慢慢產生一個脈搏跳動嘅反應。咁呢個係一個良性，我哋講即係血液循環嘅反應。第二個咧，我哋叫做一個叫做醉夢嘅反應，英文我哋叫做 holistic 嘅 relaxation。咁佢呢個人嘅狀態咧，就好似係半夢半醒，咁我哋叫做醉夢。咁有啲少似呢個催眠嘅狀態嘅。咁喺個過程咧，佢自己就會有個醒悟，有個得着，關於佢身體健康嘅問題。咁呢個我諗我用另一個例子去少少介紹下，即係嗰個作用嘅。如果我哋咁樣順暢嘅開合，但係因為我哋講，譬如細個冚親個頭，如果有一粒芝麻咁大嘅淤血，棘住咗一個咁樣嘅腦筍嘅位置，其實嗰個開合咧就咁樣棘住咗。咁兩塊其中嘅板塊棘住，其實成個頭顱骨就22嚿骨頭，就好似扭計式咁咧，就會歪晒㗎。咁但係我哋如果透過咁樣嘅處理，我用頭先個例子啦，透過將嗰粒芝麻能夠釋放佢，咁嗰粒芝麻溶咗，我哋好似啲黑頭話溶，而家溶黑頭咁樣啦，溶咗粒芝麻嘅一個淤血嘅阻塞，佢個腦筍呢個活動嘅位就可以正常個開合就能夠做得翻。咁佢呢個叫做重整啦。咁呢個重整就令到佢嗰個健康嗰個成個 facilitation 咧去改善。咁就係一個自己嘅免疫系統嘅改善，自己嘅一個健康嘅機制，就唔係我哋去用我哋嘅主導去幫佢去處理佢嘅問題，
就係釋放佢裡面嗰粒芝麻。
Exactly 啦，我哋要釋放佢嗰個能量，我哋話即係 energy 嘅一個 release 咁樣，係啦。
係，咁係咩年紀嘅人適合做顱脊治療咧？係咪咩歲數都得嘅咧？
Little Dupree came to the DMC today to get measured for a custom-made helmet. Not for football or hockey quite yet. That comes later. This is a very special helmet that will correct a condition called deformational plagiocephaly, or the flattening of the head that we sometimes see on young babies. Dr. Arlene Roselle of the DMC's Children's Hospital of Michigan is one of the best pediatric plastic reconstructive surgeons in the nation.
In the old days, we used to let babies sleep on their stomachs or wherever they felt comfortable sleeping. In the early 1990s, the American Academy of Pediatricians published a guideline that children should sleep on their backs because it greatly decreased the incidence of SIDS, sudden infant death syndrome. An infant's skull, first of all, has open growth sutures, so actually the plates of bone in their skull are mobile. Also, the infant's skull bone is very soft and very thin. Most babies will lay more on the right side of their head, 75% look to the right, and their heads are so soft and their growth sutures are mobile, so it's almost like you take your hand on each side of the head and squeeze, so you get flattening on the back on the right and the front and the left, and the head and skull base expand out in the opposite directions, almost like a jello mold. So it's not just simple flattening on the back of the head, but the whole skull base and face can shift. And again, it's a spectrum, and in some children we see very severe shifting of the entire area.
So, 75% of babies lie on their backs and turn their head to the right, resulting in many children, not all, developing this condition, this flattening on the back of the head, and some flattening on the front. This raises a few questions. First, why do they turn to the right? Does this mean 75% of all babies will develop flat heads? And if lying on their backs causes the flattening on the back of their heads, what causes it on the front left?
There are two theories about that. One is that the positions most babies are in as they come down the birth canal and get born is that they're called LAO. They turn slightly to the one side, so there's a little more pressure on the right back side of the head. The other is that most mothers are right-handed, so they hold the baby in the left arm, so the baby is turning towards mom and getting a little more pressure on the right side.
Not all babies who lie on their backs will develop deformational plagiocephaly. And the reason for the flattening on the front left? The bone of the skull in infants is so thin and soft. As the baby lies on its side with the weight of the brain pushing down on the back right and out on the sides, the front left goes down simply by gravity due to the very soft nature of the bone. So, just how common is deformational plagiocephaly?
咁講到呢度咧，我哋有少少資訊咧，我哋就喺嗰個顱脊嘅醫學特別去講解啦。原來我哋講咧，呢啲腦筍位啊，呢啲骨與骨之間，成個頭顱骨原來我哋講咧唔係一嚿過嘅，
有好多板塊黐埋。
係啊，我哋有幾個，我哋有22個板塊嘅。咁我哋時間關係，我哋唔使其實逐嚿去講咁，但係起碼我哋知道，譬如呢個額頭呢個額骨，頭頂嘅頂骨，咁而我哋頭頂額骨其實呢一度咧，呢個所謂我哋嗰啲腦縫位啊，我哋成日聽講啊腦筍未生埋，但係其實我哋講喺我哋同周醫師同 Daisy 同所有人，其實我哋個腦筍係未生埋過。原來喺我哋去到博物館，我哋講嘅頭顱骨呢啲腦筍位咧，原來仍然仲可以咧咁樣有個活動嘅。OK， 我哋呢個22塊骨頭咧，原來咧全部咧係做緊一個咁樣嘅開合嘅活動。咁原來我哋嘅頭顱骨唔係靜止嘅，包住嘅我哋講就有啲叫筋膜，而筋膜下邊我哋講所有我哋嘅組織，包括我哋嘅所謂腦膜炎嘅腦膜啦。脊椎嘅神經根嘅脊椎膜啦，內臟我哋有心膜，有肝肺，全部我哋講咧都有一啲咁樣嘅臟腑嘅內膜。咁包括我哋講有一啲肌肉啦，咁全部都係有一啲咁樣嘅筋膜。而呢啲筋膜原來咧全部都同頭先我哋講緊呢個腦唇或者腦縫嘅開合。原來我哋講有個英文字我哋叫咩 synchronize，原來係有一個協同步做緊嘅一個開合嘅活動。簡單講，我哋個頭顱骨咧，原來咧係每1分鐘咧，以呢個6至到12個循環，不斷咁做緊開同合。咁有時候我哋有趣做啲演繹咧，啲朋友話：我點知佢幾時叫做開，幾時合啊？咁個模樣係點樣㗎？咁原來佢開合嘅情況係點咧？當呢啲腦筍骨全部打開嘅時候咧，個頭咧就近似邊個咧？近似洪金寶個頭，即係比較我哋講闊啲。 平啲嘅。咁如果譬如我哋即係幾個嚟講咧，可能近似阿 Daisy 個頭可能比較我哋講比較即係闊啲、扁啲咁。呢一個我哋講比較開啲嘅一個顱骨嘅活動模式。當我哋如果即係呢啲腦筍咧合嘅時候咧，原來我哋嘅頭咧就會咁樣比較窄啲。同埋咁樣成一個長啲嘅鵝蛋形嘅，咁有啲輪廓嘅形狀其實都係我哋講一啲嘅，或者我哋講嘅色順啦，俾我哋身體健康嘅一啲嘅模樣嚟嘅。咁你話偏合嘅頭型似邊個咧？就似阿吳耀漢先生。咁原來我哋嘅頭咧，呢啲筋膜嘅開合咧，原來我哋每1分鐘咧不斷都係咁樣，吳耀漢、洪金寶、吳耀漢、洪金寶。原來我哋嘅頭，當然啦，我哋唔係真係成個頭咁變化，因為你睇啲我哋講啲腦筍位咧，好細嘅鋸齒嘅活動嚟嘅啫。咁但係嗰個活動嘅成個頭嘅模式就會係咁樣活動。咁呢個信息對我哋講重要乜嘢咧？原來呢一啲頭顱骨嘅活動，將會同我哋身體一個筋膜整個身體咧，原來係一齊做緊嘅。咁有一啲我哋講臨床上比較嚴重啲嘅病咧，我哋更加容易睇到。其中一樣嘢咧，我哋叫做帕金遜。咁我哋帕金遜嗰啲咧，其實咧全部嗰啲嘅病人咧，全部都係咁樣嘅。呢個其實就係佢嘅筋膜嘅一個叫做合嘅 pattern。簡單講，即係話佢嘅頭顱骨合實咗，開嘅時候咧有一個障礙嘅地方，包括我哋講可能只係我哋細個冚清個頭，如果有淤血，一粒芝麻咁大嘅幾血，如果積咗喺呢一啲腦縫之間，我哋呢個活動就會咁樣卡住咗。兩塊板塊，如果我哋講卡住咗咁樣嘅活動，其實成個頭顱骨22塊骨頭就好似個扭計骰咁，其實就會有個影響咗。咁嗰個就會影響咗我哋嘅腦裏邊嘅腦脊液嘅流動。咁亦會影響一個我哋叫做顱內壓啊，我就腦好似一個高壓煲咁樣。咁嗰個壓力咧，如果唔能夠暢通地做咗呢一個緩衝嘅一個所謂 buffer 嘅伸縮開合咧，裏邊嗰個壓力就壓翻我哋自己嘅腦細胞。咁我哋即係好多而家我哋對中風對腦血管意外多啲資訊，其實可能就係一粒芝麻咁大嘅血管嘅爆裂，我哋已經半身不遂啦。所以嗰個壓力嘅影響其實係可以好嚴重。咁但係我哋透過嗰個觀察咧，原來帕金遜嘅咧全部係合咗嘅，甚至我哋講手指公佢都喐唔到啊。簡單講，開合應該係順暢嘅。如果佢合住開唔到，其實呢個係一個病態嚟㗎。咁我哋講，但係個原因我哋講要去處理咧，就唔係淨係處理手腳。因為你夾硬掹嗰啲手腳其實冇意思嘅，因為佢個問題個源頭，我哋講唔係喺啲手腳嗰度，喺個腦裏邊，喺個頭顱骨呢一啲腦縫位。咁我哋嘅治療手段其實就要去感應呢一啲阻塞嘅位置，咁要令到呢一啲嘅筋膜咧，我哋就頭先我哋講類似透血，頭先講嗰個能量嘅釋放。即係如果嗰粒芝麻嘅淤血能夠有效地釋放咗佢。咁佢就能夠暢通翻呢個活動，佢裏邊嘅頭顱骨喐得翻，裏邊嗰個腦嗰個泵拼，即係 pumping 一個好似泵咁樣嘅作用咧，好似猜按我哋個腦，呢個直情係一個腦按摩，我哋冇辦法做到，呢個原來先天咧俾緊一個咁樣嘅功能，我哋咧其實不斷做緊一個咁樣嘅腦部嘅按摩，而呢一個腦部嘅按摩其實如果一啲合咗開唔到嘅症候嘅時候咧，佢就可以幫佢鬆翻個筋膜嘅活動。咁另外一個譬如我哋講睇中風都係嘅，腦血管意外我哋講左邊嘅腦血管意外就右邊嘅半身不遂。我哋講啲手腳咧嘅模樣咧，全部係一式一樣嘅。全部右腦血管意外嘅病人嗰啲手腳係全部一個模式嘅。咁呢啲都係我哋講筋膜上面嗰個 pattern 嚟嘅。咁所以我哋講嗰個治療嘅方質咧，我哋而家集中咧，如果啲症候包括我哋講。我哋今日就將頭痛、頭暈或者失眠，但係好多時有啲嘅我哋嘅臨床嘅病人咧，3樣嘢都有，而反覆地唔同時間出現。咁其實呢個我哋更加需要去探討咧，同一個病人甚至喺同一個時段裏邊有頭痛，又有頭暈，瞓覺嘅質素又唔好，我哋就可以簡單講咧，好大機會估計到佢咧其實有一個慢性嘅腦膜炎。咁喺個身體嘅積聚，咁嗰個我哋講係要盡快咧，要幫佢處理咗呢一啲嘅問題。咁簡單講咧，當然啦，我哋 頭痛，你食咗止痛藥，大部分嘅痛症都可以咁樣去抑壓到嘅。咁但係你抑壓咗唔代表你處理咗個問題喎。
嗰啲係治標不治本啊。
如果有時我哋講，當你抑壓咗，不過佢反覆地又再翻嚟。
好多時食咗止痛藥咧，就反而咧你感覺唔到個病咧，你唔去治療，重大問題，
仲危險。
延醫治療咁啊，拖長咗個療程周期咁啊。
治病即為人體自愈療法。大腦的養分是否充足，腦細胞是否活躍，經絡是否通暢，決定自我診斷、自我修復能力的大小。打個比方，人體好比倒過來的大樹，而樹根就是起決定性的大腦。樹木的榮枯取決於樹根，當樹木出現萎黃、乾枯、生長不良時，通過適當的措施激活樹根，樹木就會立刻自愈，煥發勃勃生機。而人體也可以通過激活大腦，恢復身體自愈力，來防治各種疾病。
在人体自愈力被发现之前，人们往往是通过药物来治疗疾病。随着生活水平的不断提高，环境污染的加剧和不良生活习惯的冲击，各种可怕的疾病也随之袭来。脑梗塞、脑中风、冠心病、心肌梗塞、哮喘、糖尿病，甚至是癌症，发病率越来越高，让人防不胜防。那么，传统药物疗法又存在哪些弊端呢？它又给患者带来怎样的不幸呢？
许多人在发病时，首先想到的就是去吃药。当这些药物进入人体发挥药效的时候，人体自愈力就受到了排斥和破坏，处于持续减弱或低迷状态。久而久之，许多患者根本无法感觉到自愈力的存在，而对药物产生依赖性。长期服药产生的毒副作用，不仅严重损伤了患者的肝肾功能，也大大削弱了人体的自我修复功能，雪藏了自愈力。这样，患者失去了一道与生俱来的防御屏障，只能接受药物治疗，后患无穷。据不完全统计，仅我国每年因为药毒致死、致残的人数超过30万，每年因购药使家庭陷入贫困的患者人数高达90万。一双双绝望的眼神，一张张痛苦而扭曲的脸，向我们诉说着病魔带来的悲苦与痛楚。少吃药、不吃药，依赖人体自愈力来治愈各种疾病，成为当今世界医学最炙手可热的研究方向。
Getting a lot of sleep at all. Only 3 hours, 4 hours is waking up tired, really not feeling active. I just wasn't feeling myself anymore. And
all the nerves in my nose were affected. I couldn't smell, I couldn't taste.
Get motion sickness.
I had this embarrassing drip from my nose.
And I was having problems with my friends, and I was recommended for therapy.
I was just trying to be healthier and not have so many sinus infections.
I suffered from migraines about, 10 years.
I was getting colds a lot. My nose would run often.
They said he had asthma. He was allergic to everything under the sun. Grass, cats, dogs.
My nose had always been clogged up, unable to breathe through my nose. I became a mouth breather, basically, a mouth breather.
Hi, I'm Christy Harden. Today I'll be talking with Dr. Adam Fields about how he uses cranial adjusting to solve some of the problems we just saw, and many more. Dr. Fields has been a successful chiropractor since 1995.
When we use the word cranial, we mean the head or skull. The cranium is the house for your brain. The brain controls and coordinates every function of the body. The cranium we have here is not just one solid bone. It's 22 bones that fit together like pieces in a jigsaw puzzle.
Okay, I'm intrigued. What's this about a jigsaw puzzle around the brain?
The skull has many bones. When they don't fit together perfectly, they can misalign. In reality, our head gets bigger when we take a breath in. When we breathe out, our head changes shape and comes in at the sides, and the top of our head expands upward. This constant rhythmic movement is happening to you right now. The skull, or jigsaw puzzle as we're calling it, can get locked up so it doesn't expand and contract. This is called the cranial misalignment. What's important about that misalignment, Christy, is that when the bones get misaligned, this leads to problems we saw at the beginning of the program, and altered brain function and many others.
That sounds serious. How does that happen? How do our cranial bones lose that perfect fit?
There may be something you had done knowingly or unknowingly to your skull that caused the bones to misalign or lock up.
Well, I was in a car accident. I was rear-ended, and even though I had my seatbelt on, my head went forward, and I hit the steering wheel.
We've all experienced day one, being born. In fact, I brought my spine, squeezing through the birth canal. If the skull isn't out of alignment yet, then when we're kids, we get a bump on the head, a fall off the trike.
I fell off the playground and I hit my head.
What about grinding our teeth?
Sure, just plain old poor posture.
When I was a teenager, I had 2 broken noses.
So I went to several specialists. I went to a different chiropractor to start with, and I got an MRI. They couldn't see anything. I went to ear, nose, throat specialist, and they said, "You might not ever get your smell back. I'm sorry, I cannot do anything."
I've had laser surgery done on my tonsils and in my nose.
I had to wear this mask, every single night. I had to carry this thing on a plane, and then at night I had to hook it up, and I'd fly to, let's say, Milwaukee, wake up the next morning, pack up this machine here, which was just so cumbersome, and then go through the airport and sometimes take it out.
I would have to use Flonase or Nasonex or something.
I was trying to get off of drugs and onto something a more natural solution.
It seems like a lot of us suffer from cranial misalignment, and many of us need a solution. So what do we do?
The first step is to take a meticulous history of your health. Then I conduct a strict analysis of the muscles that make up the facial architecture. I'm also looking for any structural asymmetries of the face. Even looking in the mirror, you might see one eye higher than the other, or one ear lower than the other, a jaw over to one side. These can manifest in looking older than you really are.
Dr. Fields found out that my eyes is not just balanced. One is on top. He asked me that, did you have anything wrong? And then I say that maybe because I had car accident when I was young. That's why I have, my eyes, it's not balanced.
To understand how flexible the joints of your cranium are, I perform a process called motion palpation. Often there is tenderness at the skull joints. Balance is also assessed. Then I have a clear assessment of your misalignment pattern. The pattern is different actually for each person. Now we go to the treatment. First, I perform soft tissue techniques to prepare the skull for the movement and for the rest of the body for the changes it will undergo.
This process really works. Unlocking problems in the skull does more than just treat sinus problems or headaches. It changes lives.
I no longer am a mouth breather. I've had to really relearn how to breathe with my nose because my nose is clean and pure now. I can breathe absolutely beautifully.
Thank God every day that I could smell again and taste my food.
Playing with my kids, I was able to pick them up and spin them without getting any dizziness.
I used to live on Excedrin migraine, and I had just recently purchased, there was on sale at Walgreens, 2 bottles for the price of 1, so I bought like 4 bottles, and I haven't used any of them because I don't need them anymore.
There was no fights, there was no nothing. Just playing and having fun.
Now I can breathe again.
Haven't had a sinus infection for quite a while.
My whole family said, wow, your eyes is now not crooked.
Where you don't think you can be cured or whatever, can't ever get something back, it's possible.
Thank you so much for watching. I've performed over 1,000 cranial adjustments, and I can assure you that many more people have had their lives significantly improved with cranial adjusting. Let's make sure you're next.
Uma estrada
In this short film, you will learn how craniosacral therapists can help calm an agitated nervous system and promote healing energies and total well-being at a fundamental level. The result is that a person feels better connected to themselves, a better sense of equilibrium, and a calm sense of wellness. Craniosacral therapy is not like any other healing modality. There is no channeling of energy by the therapist. It takes time to become proficient because the therapist must learn new ways of perceiving the client's mind-body system via gentle physical contact and the use of all his or her senses. Therapy starts with the ability of the practitioner to enter a state of presence oriented to the expression of something called primary respiration throughout the fluids and tissues of a client's body. The idea is that the body expresses tide-like rhythms and movements which flow through it constantly in two basic directions. This primary respiration was discovered by William Garner Sutherland, and it has nothing to do with lung breathing. In the inhalation phase of primary respiration, the potency surges from its midline superiorly and transversely to the wider field around the body. During the exhalation, the potency surges inferiorly and inwards towards the body's midline. There are different frequencies or tides that the therapist tunes into. The mid-tide and its fluid tide has a frequency of about 2 to 3 times a minute, while the long tide is the most formative level of primary respiration and is a deeper, slower rhythm of about 50 seconds for inhalation and 50 seconds for exhalation. The long tide is totally stable and is a basic resource for the person, even in the most traumatized situations. Craniosacral therapists tune into the movements of these primary rhythms by directly contacting the body with various holds and clinical intentions. This is all based upon gentle physical contact and negotiated relationship. This has many advantages. Sometimes talking about a trauma can be very difficult for a person, and doing so may overwhelm and re-traumatize them. It is also possible that damage was done a long time ago and the patient can't remember or articulate it, as with a baby. Within the context of craniosacral therapy, the practitioner holds a relational field oriented to primary respiration to allow traumatic process to express in resourced ways for true resolution. The pre-birth environment, the tremendous forces on a baby's head during birth, or shock of a cesarean, may have a huge impact. The attuning skills of a craniosacral therapist help a baby to feel listened to and to begin to relax and let go of the trauma. Practitioners help our clients to reorient to their own original health matrix or blueprint, and instead of orienting to the accident or trauma or stress, the psyche and body can let it go. Usually, it does not look as if a craniosacral therapist is actually doing much at all. This is because they are trying to help the recipient to achieve a still, calm, healing space. It is the client's own natural healing mechanisms, the primary respiration, and the innate wisdom of their own body that does the healing work. These are far more powerful and effective than any physician. Their body knows best, and this is called the inherent treatment plan. In stillness and calm, states of balance occur where tissues are reorganized and feel warmer and more comfortable. When unresolved history heals, primary respiration and its tide-like motions may be expressed in a stronger and clearer way. The nervous system may resolve its activation, and the person's body may function with greater ease. Tensions are let go of, blockages are resolved, and energy returns to places that felt cold and numb. At the close of the therapy, the body's life forces or potency, which has organizational, protective, and healing functions, may become more available so a person can resolve health problems more naturally.
孤身向前，望望回望，只想再一睹爸爸的背影。長夜孤枕，憶起當日，他的聲音悠然在耳邊，勉勵我說聲孤單靜影都不怕驚，管他應與不應。7分熱誠加3分衝勁，任旁人罵你不清醒，獻你青春立地頂天，何妨夢更長。你縱使坎坷，要立志高飛，為世人延續希冀。一個人在路途上，一生多少悲與傷，成敗得失不必多問，只管望着前路覓理想。我要摘那星，孤單靜影都不怕驚，管他應與不應。7分熱誠加3分衝勁，任旁人罵我不清醒，獻我青春立地頂天，何妨夢更長。我縱使坎坷，要立志高飛，為世人延續希冀。獻我青春立地頂天，何妨夢更長。我縱使坎坷，也要立志高飛，為世人延續希冀。加3分衝勁，任旁人罵我不清醒，獻我青春立地頂天，何妨夢更長。我縱使坎坷，要立志高飛，為世人延續希冀。獻我青春立地頂天，何妨夢更長。